shot right there. Hi Joe and Roz, this is Nicole here with Maggie, and we're going to continue working on Paws Up. From what I heard, Maggie got a little bit nervous when she was in a smaller space at the hospital. So we're going to be working on the Paws Up in a little bit of a different setting. I know we always do it in the air-conditioned area inside. We have the grooming table, which she was doing great with, but we're going to do it also on a table, and I also have a chair up on the side over here, and we're going to have her standing in a place that may be a little bit tight. So trying to recreate that small space that Maggie has to be in certain situations when we do ask her to put her paws up. All right, so we're going to start off like we always do, a little slow. We want to make sure that she recalls everything in regards to the command. Okay, sit. Good girl. Wait. Paws up. Yes. Stay. Good girl. Nice. Good girl. Good. Paws up. Good girl. Off. Good. That was a very, very good start here. And like when we do it with the chairs and things like that, different heights, different objects. I'm also going to grab a couple of things to make that smaller space here. Let's try the paws up one more time. We're going to do it a little bit quicker this time. Just going to take a little walk around here. Good. Stay. 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 Good girl. Paws up. Good girl. Good girl. Off. Good. Off. Okay, so that was very, very good. And I know because Maggie is so food motivated, if you do have a situation where you're at the hospital and you realize, she's getting a little bit nervous, she's tensing up just a little bit, she's hesitating to follow through with any commands, we have her treats here with us, and in the event that you can't get her to really focus or her anxiety levels are going up a bit, whip out some of those treats and some of different values. So a higher value treat perhaps in a situation where you find that she's a little more nervous, she does not respond to commands as well, or affection, things like that, she does not really care too much about. So if you have something that's a very high value, such as a real piece of lamb or something like that, because we know that she loves food, she is going to more often than not pay attention to you at that point. And when you do have that food here and you notice that she's in that spot, the spot that she gets a little bit nervous in, where there's close quarters, have your high value treat. She pays attention, she's making eye contact, good girl. Sit, good. And now at this point, we can ask her to put her paws up. Good, stay. And then hopefully she'll be able to do it for us. If not, don't worry. Sometimes, off. Good girl. Sometimes dogs get a little bit nervous, especially in situations where there are a lot of people around. So if she doesn't do it, that's okay. Continue to try again. And of course, she's in training as well. So if she doesn't follow through, that's just something else we know we need to work on. But do try those really high value treats, such as a real piece of meat. Something that she doesn't get all the time, to help coax her out of her anxious state that she might be in or something like that, and then proceed to ask her to perform her paws up for everybody. Okay, so we're going to bring out another chair here. The height difference is not too much, but it's a regular chair instead of a flat table or the grooming table that we've had before. I'm going to be bringing this out here. Maggie, sit. Okay, stay. Stay. Okay, so here's our chair right here. And I'm going to have Maggie positioned first off on this side here where there's an open space. Then after, I'm going to move her into the closer space between the table and the chair, proceeding to ask her to put her paws up on either item. Stay. Good girl. All right, so I think this space will be good for her. All right, good stay. Good stay. Okay? Sit. Sit. Good. Sit. Paws up. Good. Stay. 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 Good girl. Stay. Good. Paws up. Good girl. Good. All right, that was very good. And of course, when we're practicing, we want to touch her all over her face, stick our fingers in her ears, make sure that we're touching her all over. When she puts her paws up on the table, she is exposing her chest and underbelly and things like that. So we want her to, of course, be very comfortable with strangers touching her all over. So we're going to move her back into this, move her into this smaller section over here. Of course, we don't have the distraction of a lot of people present. However, if you're going to work on this at home, invite some people over, even if it's just your neighbors. Have them come over for a drink or something. Ask Maggie to perform in front of people. And of course, if you take her out, I've seen Joe with Maggie at Whole Foods before, and you take her out, have her perform, maybe not when there's tons of people around, but let's say a bench or something outside of a busy area. Ask her to do her tricks and follow through with her commands while she's out in the world and there's not a lot of people in a smaller space crowding around her. That would help her get a little bit more comfortable with people watching, people around her. Sometimes people try to touch the dogs, so having her exposed in that environment would be good, but not having her in a really closed space with tons of people in the very beginning. So we want to get her more used to being in situations where there are people around, especially in the hospital setting when there might be, upwards of 10 to 15 people in a small room. So we're gonna bring Maggie right over here. Good. All right, she's jumping the gun a little bit there. That's okay. Oh, she did move from that. So let's get her right back in there. Maggie, come. Good girl. All right, so let's try this again. She really, really wants to do something. She wants to make sure that she's working right now. However, I didn't ask her to do anything yet. So if she jumps up on the table here, or if she starts putting her paws on things, I'm gonna not something I want her to do. And then we can walk right back around and try it again. Good girl. Stay. Good. Sit. No. Sit. Good. Stay. Good girl. Stay. Good girl. Okay, come. Good girl, Maggie. Good girl. Okay, so I want her to associate the things that move around and make noises with positive things. So by having her practice being in that smaller space, we're moving things around first in the very beginning just because I saw she got a little bit nervous there. I want to make sure she can stay. I can move the chair a little bit, but I'm not going to have her stay for a very long time because I know she gets a little bit anxious when there are inanimate objects moving around her. So we'll try that again. Maggie, come. Good. Stay. Stay. Good. Stay. Why doesn't she look very cute here? Stay. Stay. Good girl. Paws up. Good girl. Good girl, Maggie. Good girl. Good girl. All right, that was excellent. Let's try it one more time. Good. Stay. 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 Good girl. Paws up. Good girl. Off. Good. Good, Maggie. Good girl. All right, so because I know she already knows the command, it's just a little bit of anxiety that gets to her when she's in those smaller spaces or we have those objects moving around. So it's all a matter of desensitizing her to being in confined areas and also to have stuff moving around. If you have access to things like wheelchairs that maybe you can borrow so we can move them, or you can move them around when you're working with her, ask her to put her paws up on the wheelchair, so on and so forth. And of course, having her in those small spaces, asking her to stay, maybe moving something around just a little bit, and then rewarding her for being a good girl and maintaining that stay. Let's try one more. Stay. Good girl. Stay. Good. Stay. Good. Okay. Paws up. Good. Stay. Good. Paws up. Good girl, Max. Good girl. Good girl. Off. Good. Good. All right. That was really, really well. She did that really, really well. Very proud of her. She may have, again, just like I said, a little bit of anxiety with the smaller spaces, but that's something very trivial to work through. She did an awesome job. Very impressive. And if you feel that maybe she's getting a little bit nervous going into certain places, try to do a little bit of training with her prior to entering that area. Kind of get her into the zone and work with her from there. But she did a good job, though. I'm so proud of her. This has been Nicole here with Maggie. We've been continuing our work on Paws Up. We'll see you later. Bye.